Good afternoon or good morning, everyone, depending on where you are. I'm Jamie Hoy with JBS International. Thank you for joining us for today's webinar, Introduction to State TA. Before we begin, I'd like to review a few housekeeping items. As you come in, please add your name and what state you're from in the chat. And due to the high number of participants on this call, all participant lines will be muted for the duration of the webinar session. If you have any comments or questions, please submit them at any time by using the Q&A feature. To open your Q&A window, please click on the Q&A icon located in the bottom center of your Zoom window. As another point of note, we're so pleased to have AI Media present to provide live captioning services for our webinar today. To view captions, click the caption button located at the bottom of your Zoom window. If you don't see a captions button, you may need to click the More button and choose Captions from the menu there. From there, you can choose caption settings where you'll be able to adjust the size of your captions. You can also click the link provided by AI located in the chat, which will create a separate reading window to view the full transcript in that way. And they'll be putting that in there shortly. If you experience any technical issues during this webinar, please message us using the chat feature, which is located at the bottom center of your screen, or email us at samhsastateta@jbsinternational.com. Lastly, this is a recorded event, and your participation grants your consent to be recorded. The recorded webinar and PowerPoint slides will be available and sent to participants at a later date. Today's presenters are Director Danielle Johnson-Bird, Director of Division of State and Community Systems, Center for Substance Abuse Treatment, SAMHSA. Angie Jones, JBS International, Project Director for the State TA Project. Sue Goddich, JBS International, Task Lead for State TA Project. Brian Jones, JBS International, also with State TA Project. And Larry Cuellar, JBS International, also Task Lead for State TA. I'm going to go ahead and move to the disclaimer side. Before we begin, I'd like to read the following disclaimer. The views, opinions, and content expressed in this presentation do not necessarily reflect the views, opinions, or policies of the Center for Substance Abuse Services, the Substance Abuse and Mental Health Services Administration, or the U.S. Department of Health and Human Services. Without further ado, Director Bird, I'll turn it over to you.
Thank you, Jamie. Good afternoon, everyone. I'd like to welcome you to the kickoff of the State Program Improvement TA Project. We're really excited about and committed to this effort as it's intended to provide support to you in the implementation of SAMHSA's block grants. SAMHSA considers this to be the first step of many to work collaboratively with you as we endeavor to address substance use and mental health service needs. With that, I'm going to turn it over to Angie Jones of JBS. Thank you.
Thank you so much, Dr. Bird. We really appreciate it. And we are so excited to talk about the State TA project and to begin giving you an overview of this project. Next slide. The goal and purpose of this State TA project is to support SAMHSA's mission by providing technical assistance to recipients of the Substance Use Prevention, Treatment, and Recovery Services Block Grant. And the Community Mental Health Services Block Grant, including the Olmstead decision. This project emphasizes cross-agency program improvement efforts. This project is unique in that the key audience for TA services are state agency leadership. In addition, this project is unique because it's focused around implementation of the block grant. Next slide. The State TA project supports SAMHSA's mission and strategic initiatives by assisting in technical assistance around planning, design, and implementation. The project carefully works to assess states' underlying needs, determine the most appropriate solutions to address those needs, and employ sound practices to carry out and evaluate technical assistance, which we will talk more about in future slides. Next slide. This project serves all 50 states in the District of Columbia, territories and Pacific jurisdictions, as well as the Red Lake Band of Chippewa Indians. Next slide. The project is jointly funded by the Center for Substance Abuse Treatment and the Center for Mental Health Services. Next slide. Our partners, JBS International, has partnered with several wonderful partnering agencies to work on this state DA project. So we have partnered, some of our partners are more focused on mental health, some are more focused on substance use services. So APT, Advocates for Human Potential, National Association of State Mental Health Program Directors, NASHPD Research Institute, National Association of State Alcohol and Drug Abuse Directors, NASDAD, and SMHAs. SMHAs is working with us on some of our IT projects associated with this project. Next slide. So the objectives of this project are to improve the effectiveness and efficiency of the use of block grant funds by states and territories, including the implementation of block grant MOEs and set-asides. We also aim to improve the adoption and use of promising best and evidence-based practices. We will work to improve mechanisms for collective and peer-to-peer TA among states and territories, including learning collaboratives and other communities of practice. And finally, we'll work to improve effective response to issues identified for individual states and territories, as well as broader trends among them through compliance and evaluation activity. So we're so excited. We really have a wonderful opportunity to work directly with states to meet your needs in whatever way that looks like. People are welcome to submit TA requests for both for on-site and off-site TA. Sue is going to talk more about that. We have lots of great activities around evidence-based practices that we'll be talking more about later today. There are learning collaboratives, which we're going to kind of focus on and talk through, but we know that you learn best from learning from one another and hearing from other states. So we're so excited to offer learning collaboratives. And finally, as we hear what's working and not working in states, we hope to kind of compile that information and offer it back. This is all in collaboration with our partner, SAMHSA, and the Center for Substance Abuse Treatment. Next slide. Our approaches to TA. So first, we're going to identify every time that we find that there's a TA request out there, we're going to work to identify the experts and resources that meet your state's needs. We will work hand in hand with you. If there are folks that you like or you want to work with, we'll work with those experts. If you don't have an idea of someone to work with, we'll work to identify some experts. Next, we'll provide the TA. So we will work to provide technical assistance, training, and consultation to states and territories in the effective and efficient use of the mental health block grant and the SUPTRS BG, so the new name of the block grant. We also will work to disseminate and support the adoption of promising best and evidence-based practices. And again, you're going to hear more about this as we go along, but we're working hand in hand with CSAT to understand best practices that need to be promoted and to get new information out about those. Next slide. All right, so I am now going to turn it over to my colleague, Sue Goddage, who's going to talk about our services that are available. Sue.
Thank you very much, Angie. As you can see, this slide specifically indicates that this is for the state-specific request for technical assistance. You'll see later on in this presentation some webinars that will be delivered in a more broad sense and are open and available to any and all states. But this particular opportunity is the ability to really begin to hone in on what your state needs are and the delivery mechanism that we have identified above. So there are the example for off-site technical assistance may include things things like conference calls, assistance in the development of materials for distribution at your state level, and the development of webinars for your intermediaries. The on-site technical assistance actually means that we would be coming on-site, and it could be things that are related to emerging trends that you are experiencing in your states. An example could be an increase in xylazine use, the importance of specific wound care, or low threshold naloxone distribution or other harm reduction strategies. And then last but not least are the state-specific information requests, and examples of those may be things related to literature reviews, identification and linkages related to innovations from other states, or resource development. Next slide, please. So some examples of the technical assistance that are available. You are developing a needs assessment on a regular basis to support the block grant, but also, it may be some things that could help in linkages to your strategic plan that is created through your advisory board or your advisory council and so on. The set-aside implementation. Obviously, there is the women's specific set-aside. It could be things related to the provision of care for pregnant and postpartum individuals, but then also things related to morbidity and mortality. If you are a state designated HIV state, and that would be an opportunity for some set-aside activities as well. The performance management and outcome measurements are related to quality assurance and quality improvement plans. Workforce development specifically is really beginning to look at areas and how to create those specific statewide partnerships with things like your licensing board, Medicaid, potentially to codify work. An example could be for peer support specialists, and then also to partner with post-secondary schools as you are developing your actual workforce for the delivery of substance use disorder prevention and treatment services. Financing strategies could be an example of that, may be something related to your 1115 waivers and connections with other states with similar waivers. And now I will hand it back to Angie, and she will talk about the state TA plans.
Thank you, Sue. So our state TA plans, it's an opportunity for states to take a deeper look at their system and think through how they would want to reach an ideal system. It's a really unique opportunity to work alongside a TA provider and understand system strengths and needs. In collaboration with the state, we will design a technical assistance plan that addresses needs and considers current capacity to implement the technical assistance. So we always want to be thoughtful of your current capacity, what's actually feasible at this time. We know you have many competing demands, so we want to make sure that the technical assistance is just right for what you need at this time. I'm going to hand things back to my colleague, or over to Brian, my colleague, to talk about resource development. Brian.
Thank you, Angie. Hi, everyone. I'm Brian Jones with JBS International. I'm going to talk about two sets of resources designed to provide TA specific to SUD treatment and recovery services and the implementation of the SUPTRS BG. So the first grouping is to promote and support the implementation of evidence-based practices. And these resources will come in a variety of formats, as you can see on the slide there. So to initiate this task and get this process rolling, our partner NASDAD conducted an environmental scan to prepare an inventory of existing, emerging, and promising EBPs that address SUD treatment and recovery. Since then, we've held meetings of an advisory group we call the triage team, and we've been discussing the identification and promotion of promising practices and emerging evidence-based practices, and how to develop resources that would best support you in this area. So working with SAMHSA and the triage team, we've developed two broader focus areas for this work: medications for opioid use disorder, or MOUD, and recovery. So the plan is to develop at least one resource of each of the types that you see here associated with these two topics. And to give you a relative sense of the lengths of these resources, the guidance manuals would be the larger of the documents, in the 50 to 80 page range. Brochures, I think you can get a sense of that. The brief reference documents are truly pretty brief, up to 2 pages. And issue briefs are the more medium-sized document of the group, around 10 pages or so. So to give an example of what these resources will look like, we're looking at developing an issue brief about expanding access to MOUD, addressing barriers to broader use. And another example would be a brief reference document underway about patient-centered care in opioid treatment. And for all these resources, the concept of fit of practice with the SUPTRS BG grant recipients will be an important focus element for these. And our goal for these resources is that they complement one another. For example, you'll be able to find more in-depth material about the content of, say, one of the brief reference documents in the larger guidance manuals. Next slide, please. So another type of resource that the team is looking at are called Program Improvement Behavioral Health Resources. And these will be 3 documents around 20 pages in length, and we'll be developing a set of 3 annually. So working with SMHAs, we've selected focus areas for this year's first group of 3 resources in this type. So one of those will be on recovery. As you know, SAMHSA has supported a greater focus on recovery with the launch of the Office of Recovery and recognition of recovery as a cross-cutting principle through SAMHSA's policies and programs, and even the updated name of these programs, the grant program. So one of the resources will review the growth of states in providing recovery services through SUPTRS BG, talk about issues of finding and funding recovery support services, peer services, inclusion, sustainability, and many more related concepts. And looking at this from the perspective that recovery can be a lifestyle, a goal, and a service all at once, and thinking of recovery as a service as well as a destination. The second resource will examine emerging issues related to the COVID pandemic. For example, the use of telehealth during the pandemic, the sustainability of telehealth and the future of telehealth in the treatment of SUDs and recovery. And it'll also look at the pandemic and issues of recovery, of issues of equity and the impact of the pandemic on SUD treatment in special populations. The third resource will focus on the pandemic and how the drug overdose crisis are having disproportionate impacts. So we'll talk about how to improve equity in SUD treatment systems. It will look at issues like disparities in engagement in research, access to treatment and health outcomes, the inequities facing and the needs of specific populations, workforce issues, holistic and culturally appropriate treatment approaches, the role of racism and discrimination, connections with criminal justice systems, and other related topics. So these resources support the goal of providing TA specific to SUD treatment and recovery services. And they will be designed with you and your partners and providers as the audience. And so we're hoping you'll find them very informative and useful, and we'll welcome your feedback. Thank you. I'll pass it back to Sue.
Okay, thank you very much, Brian. So these are the broader base webinars that I discussed earlier. They include topics of interest that were identified by CSAT and include specific topics related to contingency management, strengthening the quality of applications submitted to the state's SSA's office by your intermediaries, and then upcoming changes to the 2024-2025 block grant application. And so now I will turn it over to Larry to talk about the learning collaboratives.
Hello, everyone. Good afternoon. My name is Larry Cuellar, and I am going to be talking about the SAMHSA CSAT Learning Collaboratives. So what are learning collaboratives? Well, SAMHSA's vision and objective for these learning collaboratives is to create a forum that can promote peer-to-peer technical assistance. So at these learning collaboratives, grantees will have the opportunity to identify best practices that can be tried and shared with other grantees. This year, the SAMHSA CSAT is convening 2 learning collaboratives. One of them is going to be on improving data collection and reporting. And then the second one is going to be addressing workforce issues around recruitment and retention. So since this is an interactive learning space, we're asking that participants commit to attending 6 virtual meetings that will be from 1.5 hours to 2 hours over the next 6 months. And I will tell you that at the end of both learning collaboratives, SAMHSA will host a webinar that will share the best practices and any lessons learned in the learning collaboratives. So if you don't have the opportunity to participate in one of the learning collaboratives this year, you will still have the opportunity to hear about the findings, lessons, and any best practices that came out of the learning collaboratives. And these final webinars that we have planned for September will be open to all grantees, and you will get more information on that as we schedule them. So now punting it back over to Angie.
Thank you, Larry. All right, so now we want to tell you maybe the most important thing, which is how do you access these services? And we really, really hope you will. So next slide. So as we mentioned earlier, there is technical assistance and training available to states, territories, to on-site, off-site, to ask for things that you need that will help your system. And you can access these services by emailing the state TA team at JBS at the following email address, SAMHSA state TA at jbsinternational.com. Once you email us, we will send you a short form to tell us a little bit of additional information about the technical assistance you're requesting. We will route that through your SSA. So we're always going to need approval from an SSA in order for this to move forward to SAMHSA. So it will go from your SSA to the state project officer for approval and some others at SAMHSA. But our intention is to provide excellent technical assistance that really meets your needs. And we do hope you will take advantage of this great opportunity to get technical assistance and training for your state or territory. So please, jot this address down. We also sent a letter that has the same email address. So we're certainly hoping that folks will, just send us an email and we can get the technical assistance started or a request started. So, all right, I am now going to turn it over to Jamie, and Jamie is going to get us started with some questions and answers. So we have, I'm turning it over to Jamie.
Sure. Thanks, Angie. At this time, we can field some questions that you may have. If you wouldn't mind putting them in the Q&A section on your menu. Right now, Angie, I'm not showing any questions at this time. I don't think I see any in the chat as well. So
we can give it a minute. Hopefully folks have some questions.
Yeah. Is everyone finding the Q&A button on their menu well enough? Here we go. This is from Melissa Hopkins. She says, you mentioned 6 webinars is recommended in 6 months. Do you have a list of these webinars?
Okay, I think that she is referring to the learning collaboratives, and the learning collaborative schedules will be sent out. I think, Larry, tell us where we are in the process with learning collaboratives, because we'll send out that additional information as folks are joining the learning collaboratives. So Larry, do you want to talk a little bit about that?
Sure, seeing as I struggle with my unmute button, I'll get right to that. So we're in the process of sending out invites to the 2 learning collaboratives I spoke about. The first one on data collection, those have, the invites went out this week. And what SAMHSA is going through a process where there's a list. So we'll invite an initial jurisdictions, and then after if there's anybody on that list that chooses not to participate, we'll continue to go down that list so that we can get as many jurisdictions to participate as possible. So what's most important about the learning collaboratives, we are going to have 6 that are going to be interactive, spaced out about every 2 weeks. What is the important takeaway about the webinars is that there's going to be a final one in September. And this final one will summarize everything that was learned within those 6 learning collaboratives. And you will be getting information on when we schedule those probably pretty early, like in July or August, before the final webinar takes place.
Thank you, Larry.
I have
All right.
another question. But I have a message. Andrea, did you want to speak on that previous question at all?
No,
Okay.
I was mentioned.
Gotcha. Okay, our second question is from Corliss Powell. May we copy the SSA when we send our request to save a step?
So what we're actually going to do, that's an excellent question. I love that you're being efficient there. What we're actually going to do is once you send us an email, we're going to send you a form, and it's a web-based form that you fill out. So you just send us an email and say, I would like to request TA, and then we'll send you a web-based form that you fill out. And after it's routed past you, it will get routed to your SSA, and it's literally the click of a button. I do think it's really smart to go ahead and let your SSA know that you're putting this request forward so that there's no surprises and, you know, there's no confusion at the state level. And yes, thank you.
I have another one. Your PowerPoint uses the term SUPTRS. We're aware of the federal language change, but we've not received an official notice from SAMHSA on that acronym. When I asked our PO, we were told to hold off.
Yeah, I think Dantrell, do you want to take this? Somebody from SAMHSA?
Sure. This is
There you go.
no worries. I wasn't sure if Director Byrd was still on the line. So my name is Talisha Searcy. I'm the Director of the Office of Performance Analysis and Management within CSAT. We hear you. We are in the process now of updating quite a few materials. You will see when the 2024-2025 guidance is released, or application guidance and reporting requirements are released, we will be using the new program name that was communicated as part of the omnibus. So there will be additional guidance forthcoming. It's just that we're dealing with the timing of when things go official versus when we're trying to meet with you all now. But we will be following up. I'll follow up with Director Byrd as well as the SPOs just to make sure that everyone has consistent information, because you will see once the 2024-2025 application materials are released that we are using the new mandated name for the block grant.
All right, I have one more in the Q&A, and then I think I see some that have been dropped into the chat as well. Anna de Jong, what is the status of the TA tracker?
Well, that's a great question. That's the reason we're using the form right now. It is still going through development and some security processes. So hope that the TA tracker will be up and going, soon. But in the absence of that, we've developed an alternate mechanism, which is this online web-based form that we're talking about to collect information until it's fully operational.
Okay, and Michael Linger would like to ask, is the SAMHSA Learning Collaborative related to data collection associated with the TA?
So I'm just going to get clarification. So Michael, is your question regarding whether the information in our learning collaborative related to data collection, is that related to technical assistance that we're providing around data collection? Is that what I'm hearing?
It sounds like it is. This is Michael Langer. It would be great to have some flexibility in the number of staff who can participate. Since it is virtual, is the 3 staff limit a hard rule?
I can actually take this question really quickly. So I don't want folks to think that the learning collaborative participation is the only opportunity that you will have to get TA as it pertains to how you're collecting your data or how you may be reporting your data in WebBGAS. The learning collaborative was really designed to bring folks together to not only learn from one another, but to also have some information that can read out to all of our grantees so that we're able to learn from the experiences and things that were shared during the learning collaborative. One of the things that we are working to do is as part of our compliance review process, but also as you're engaging with your SPOs, if you are having issues with data collection that will require TA that is specific to you, please feel free to use the direct TA form and request that assistance. So I want to make sure that folks understand that they're not mutually exclusive. You can get one-on-one TA for your data reporting and not participate in the learning collaborative.
That's a great point. Yes, we really hope that you will request that TA, Michael. That would be a great way to use the on-site and off-site TA that's available. Thank you. All right.
And Kimberly Fornero, can multiple staff from the state participate? Those that specifically focus as well as one assigned to attend?
Is Kim talking about the for the learning collaborative?
This is just a separate question in the chat.
Yes, she is. Okay. All right. So I think that we have limited the learning collaboratives to 3 staff per state. If this is something that your state wanted to have some more data assistance around, we would be happy to, have TA requests around that, Kim. We would love to see those come in.
Okay, I've got a couple more in the Q&A. Are states able to request training, TA, consultation pertaining to specific treatment models or emerging best practices, in parentheses, contingency management, sequential intercept model, etc.? If so, would this look like a training/consultation or just resources?
It could look like either. The answer is yes. You are able to request TA, and I'm looking at Talisha. She's nodding her head, so I'm okay here. Yes, you can request TA that around specific evidence-based practices. And yes, you could request that it would be training. You could request that it would be technical assistance, or you could request that it's resources. So in our contract, we have the availability to do all of those. If it's more like resources, that fits in one category of the contract. If it's more like on-site training or technical assistance, that's a different category, but all are allowable. Talisha, Dantrell, do you want to say anything else about that?
Nope, that information is accurate.
We have another one. Does the contract with JBS completely replace SAMHSA's use of an NOA for TA? Is that correct, or does SAMHSA plan to also issue NOAs for TA?
So that is a question we would need to follow up with Director Byrd to address. It is my understanding that this contract may not preclude SAMHSA providing resources directly to states so that you all can develop your own TA or address your own TA needs. However, I am not the person that can speak on any funding opportunities that are going to be made available currently or in the future. We can definitely take note of this question and follow up with Director Byrd regarding a response that could go out through your SPOs.
I have a couple more. In order to provide the best input/expertise, are we able to request more than 3 participants participate in the learning collaboratives? I think we answered that earlier on.
Yeah, and Dantrell, Talisha, are we, anything else you want to say about that?
No, the learning collaboratives are meant to be smaller cohorts for peer-to-peer training. So we're really trying to make sure that we're limited to a smaller group. However, as mentioned, we will have a larger webinar at the end of each learning collaborative that everyone will be invited to. And also, this is not the only opportunity where states can be involved in the learning collaborative. So we will have them in the subsequent years as well.
That answers your question, Janet. Rebecca Roth would like to ask, can TA include hosting and facilitating community listening sessions for needs assessment / strategic planning for block grant?
So that sounds fine on its face. All of the TA requests as they come in, we send them forward to SAMHSA for approval. And so, it would go through that normal process, but it sounds fine on its face. And again, Dantrell, Talisha, do you want to say something more different?
Nope, I think you covered it. It would have to be reviewed by the state project officer to make sure that it's in compliance with what's allowable under the contract, as well as reviewed by the branch chief. And then if it's approved, then after we have additional information, we can get that started.
Okay. Jamie Hansen would like to ask, can a TA be used for the Behavioral Health Advisory Council?
So I think you are referring to, yes, a joint mental health and substance use planning council, I think is what you're referring to. And yes, I think that is a fine use, but again, I'm going to look to my SAMHSA colleagues to add anything else they'd like to say.
Nope, just the same information as provided previously. Once we have additional information and it goes through the proper routing channels, we can provide approval.
And yes, Angie, yes, she was saying yes, that's what she was asking about. Okay, thank you. Okay, that's all of the questions so far that I see. I'm going to give a few more minutes for a few seconds to see if there's anything else out there. If anyone wants to ask anything else, you can drop it in the chat or in the Q&A.
I'm just going to give one last plug. We really hope you will consider submitting some TA requests, and we really look forward to working with everyone and providing TA and technical assistance that's meaningful to your state around the block grant. So we certainly hope folks will consider, thinking through TA requests that you may have that we can help with. And that email address is available to you. So the SAMHSA State TA at jbsinternational.com. I think we have it in the chat. I think we've put it there, but maybe we'll put it there one more, or we could go back one more time, Jamie, and just show that email address to folks. There you go. So if you didn't get to write it down, there it is. There you go. And Heidi's put it in the chat too. So.
Okay, no more questions have come in.
Thank you all. We hope that you'll request some technical assistance, and we really look forward to working with everyone.